It's not just what, but where. It's not just pursuing your specialty, but finding your special place in the world. Because in the end, it's not just about building a practice, it's about building a life. The Iroquois Healthcare Alliance was created to help physicians find the best of both worlds, both professionally and personally. Representing 55 hospitals and healthcare systems in 31 counties of upstate New York, we have opportunities for healthcare professionals in a wide variety of environments. From diversified, culturally rich mid-sized cities to quaint communities right off a postcard. Upstate life is manageable, a place where you can grow professionally with first-rate colleagues, yet also have easy access to the activities and cultural pursuits that you enjoy, where you can give patients the personal attention and quality care they deserve, where you can become part of a community, take a leading role in your profession, where you can become one of a kind, not one in a million. Deciding where to pursue your practice is a major decision, but you don't have to make it alone. We'd welcome the opportunity to sit down and discuss your future with you. And to begin, we'd like you to hear from some of our upstate physicians.
I was from upstate New York.
I came from Brooklyn.
I was born and raised in Waukegan, Illinois. It's a suburb just north of Chicago.
I grew up in northern New Jersey.
I am originally from southern New Jersey.
That was 35 years ago, and I virtually never left.
Just past the time where I've now been in Rochester as my home for like 27 years.
Moved to Albany in upstate New York to practice, and I've been here for 16 years.
I've traveled all over the world. In my medical profession as an international visiting professor and in a variety of roles, so I've seen the rest of the world at its best in many circumstances, and at its best, upstate New York is as good as anything anywhere in the world.
I mean, we've had the opportunity to move back to Chicago since we've been here, and I actually now have decided we'd rather stay here.
Well, never having been to the upstate area before, I wasn't sure of what to expect.
When my parents sent me up, they really thought they were sending me to the Arctic wilderness.
You thought of New York as New York City, so I really thought it was going to be the stereotypical, lots of traffic.
And of course, once they came up, they loved it. They ended up living here.
We kept 2 independent lists. I would rank all the residency programs as I liked them, and she was ranking the communities, because if she's not happy, I'm not going to be happy working 100 hours a week. And it was easy because both ended up being for Rochester, New York.
We came to Albany, looked around, really kind of fell in love with the community.
We have a fulfilled life living here.
First of all and foremost, the quality and caliber of medical practice in upstate New York is on a par with any place in the nation.
So it's large enough to be sophisticated from a medical standpoint, yet it's small enough where you can make a difference.
I was really impressed by the level of medicine, the integrity of the physicians, and most importantly, the collegiality, which I thought was a real optimal way to practice medicine.
The medical community knows one another.
And I think that the reason why we practice medicine is to help our patients, and the medical community here really fosters that.
You can really make a difference in upstate New York.
I think the quality of life has been so good and fits what my wife and I have wanted in our family that I've been able to be in the same position since 1982. And have developed special relationships with a lot of my patients.
I would measure our quality of life up against anywhere in the country.
It's about your recreational time, what you're going to do with your leisure time, time that you might waste in commuting in major cities, etc. It's remarkable. You spend your time focusing on what you want to get done.
The area lends itself to the ability to juggle a busy life. Things are very easy here.
We can be up in the Adirondacks in an hour.
You didn't have to travel very far.
There's no other place in the world like the Finger Lakes.
You don't have to take time off from work. You can, if you have 2 days in a row, you can get away for a little bit. So we really enjoyed the outdoors.
I was exposed to things that I had never been exposed to before.
We did a lot of hiking, cross-country skiing, downhill skiing, canoeing in the summer, camping. We loved it.
Not only are they great family activities, and you can continue to do them with your family throughout our lives, they're a lot of fun.
I love water sports.
I picked up a few new hobbies along the way.
I love to swim.
We played a lot of bad golf together.
Absolutely. Our games haven't improved a bit.
Our games have not improved, but we had a lot of fun doing it. I played golf courses where I can basically almost walk on, and they're beautiful.
I have a sailboat that I keep on Lake Champlain.
I'm an avid fly fisherman.
I love to fish.
I also am an avid bicyclist.
I water ski.
Not that you can't bike anywhere, but Western New York State is just beautiful as far as rolling hills.
I enjoy being on the water.
plenty of water.
40 minutes, we're at a ski area.
I learned to ski at age 37, and I had a ball doing it.
You know, we have Whiteface Mountain being where the Olympics were held at one point. So the skiing is good here.
10 minutes from my house, I'm completely gone from the urban environment.
Each fall, we now take a hike to, to see the fall foliage up in the Lake George area, and the kids really like that.
The fall is glorious here.
Everything that you want, whether it's culturally, historically, sports, you name it, it's all here. And it's available to professionals that want to come here and make a life.
Everything's accessible to you. You don't feel isolated from, civilization.
You really need to look at the whole picture and how affordable it is to live in a community.
It's a nice community to raise kids. My kids were young at the time.
This is a wonderful place to raise a family. It's safe, it's secure.
Housing is very affordable.
With juggling a professional career with children having activities, it's nice that they're all very localized right in the community.
My kids have been involved in things inside and out of school, which have, helped them to grow.
There are three high schools in Rochester that are typically in the top 100 in the country every single year.
The opportunities are endless for the kids.
And they love it here. They've loved going to school here, and I think that it's been a very positive experience for them, and will carry them to wherever they go.
We have recruited people who have never been in this region, and they come up here and tend to stay here because they have discovered that this is a wonderful place to live.
We ended up with a lot of transplanted people who we somehow managed to get them to take a look at this region of upstate New York.
Really give it a good hard look.
Look at the whole package.
Look at our medical community.
Look at what's important in your life.
Look at the docs in the community, and the enthusiasm and the professionalism, the integrity.
And once they looked, they came and they stayed.
You'll realize that it's an optimal place to practice medicine and to render good care to your patients.
If you want to make a difference in your hospital, you can make a difference. If you want to make a difference in your medical society, you can make a difference. Talk to the doctors that are here. The doctors that are here love being here, and they don't want to be anywhere else. And there's got to be a reason for that. If those reasons resonate with you, then come and join us.
It's a great place to live and a great place to practice.